Let's get started. Welcome everyone again to our session. Today we will be finalizing our Project Echo model sessions. This is our fourth session on the tools and strategies for nutrition and exercise quality improvement. Project Echo model sessions. In this session, we'll be focusing on solutions for physical activity improvement. Again, this is just a kind reminder that all participants are muted. Please make sure that you also engage in the chat. This is something that we've been doing throughout today's session, but just in case this is the first time you're joining us today, these are just some of the reminders. Please raise your hand if you would like your line to be unmuted. This meeting is also being recorded. The slides and the recorded link will be sent to you all via email after today's session. You can also find the final copy of the slides on the iEcho platform. So you're more than welcome to download that as well. And please also let us know in the chat if you're new to the group, what is your name, your title, what state you're joining us from, and the organization that you represent. And then the mission of the National Center for Health and Public Housing is to strengthen the capacity of FQHC primary care, public housing primary care health centers, and other health center grantees. By providing training and technical assistance, the content of this webinar does not represent the official views of HRSA, HHS, or the U.S. government. My name is Frida Pineda, and with me I have my colleague, Jimoke. She is the Health Communications and Research Analyst, and we will both be handling the logistics for the Zoom. And of course, we also have our amazing speaker for today's session, Dr. Jose Leon, who is NCHPH's Chief Medical Officer. And he will go ahead and get us started with a few poll questions to kind of get everybody already engaging for today's session.
Thank you, Fide. And good afternoon, everyone, or good morning, if you are on the West Coast. And thank you so much for joining. Today, we are going to have we are going to cover a really interesting topic. This part of nutrition and part of what we recommend to our patients who are overweight or obese. But there are some challenges when we talk about an exercise program. So we have a poll questions, two poll questions for you. One is, does your organization provide an exercise program to patients who are overweight or obese? Let us know. Fide, can we open the poll question? We're going to give a few seconds for participants to respond. Let us know whether your organization provide or has in place or has set up an exercise program. All right, can we see the results?
We still have a few answers
Yeah,
coming in.
Okay, perfect.
So once the number stops, I'll call in. All right, I think it should be good. Oops. I think this took me to another. Okay, there you go. Does your organization provide? No, due to brain talks and referral to locations, not my organization, but I do have outside resources. No, and we're working on starting a family weight training program.
Excellent, excellent. So I think that these responses can also help us with the second organization, with the second question, I'm sorry. Does your organization work with local community programs or have developed an exercise referral program, or is in the process of developing a referral network? All right, Fidel, let's take a look at the answers.
Mhm. No and yes, and somebody said that they're not sure.
Okay,
Mhm.
thank you so much. I'm not fast enough to answer the question. I'm sorry, Alicia. We closed the poll too fast. But if anyone can, or if anyone would like to provide a response verbally about this particular topic, let us know. Fide can um, open the microphone and you can provide your experience verbally. It would be nice to hear, whether you are providing an exercise program or if you have an exercise program in place or if you are working with a community organization. You can use the hand raise icon,
They can also unmute your line
or you
if
or you
you're
can
able to.
mute your line and let us know if you would like to chime in on this.
Hello.
Hi, Lisa.
Hi. So we, as an organization, do not have anything in place, but that's part of what my job is to find resources. So we collaborate with our local health department, who we are in the middle of doing bingo size. So it's a part bingo, part exercise. They do a couple of things at bingo, and then they'll do a couple exercises. It goes back and forth. We are
Okay.
getting ready to do a program called Stepping On, which is a falls prevention program. So I outsource locally.
Excellent. And Lisa, who is, I mean, once you identify, what is the process of identifying the patients? Who can attend these sessions? I guess that's the question.
So I am a service coordinator for seniors 62 and over
Okay.
in affordable housing. So I make up a calendar, and when I find the resources that will come in, I put it on the calendar, and residents just come. There are some that we do have sign up sheets for, but most of them just come down to the whatever we have going on.
Okay. And I guess that my last question is there a process to make sure that the patients are or the people are healthy enough to participate in these sessions? Is there anything that you
Um,
coordinate?
not as far as I know. I don't think there's any like initial evaluation. There
Okay.
will be for the stepping on program. They'll do a falls prevention plan in each apartment, and kind of see where the strengths and weaknesses are, what they can avoid. But as far as anything else, no.
Okay. But thank you so much for sharing your experience. It's great to hear that you are working on this particular issue. It's really important to offer these programs to the populations that you serve because as we are going to see, there are some challenges at any level, at the clinician level, at the patient level, and at the organization level. So, Fidel, let's go to the next slide, please.
Mhm. Oh, we also did receive a response in
Oh,
the
okay.
chat from Alicia Armstrong.
Okay.
She said Council on Aging for free classes for those who are eligible, silver sneakers, free walking programs, local gyms, cardiac rehab, free programs through our NEK Prosper program. There are a few over the summer, but not a lot.
Okay. Thank you, Alicia. That's great to hear as well. Thank you so much. Uh, let's go to the next slide, please.
Mhm.
Okay, why is this important? Because we know that because of technology and different reasons, people responsibilities, people are not exercising at all or are exercising less. So there is data from different sources showing that women and men are reporting that they are not exercising or exercising just a couple of days, or they don't have a routine. They exercise when they can. So what is happening is there is a correlation. We are seeing these responses from people saying that they are not exercising. And when we look at the obesity data, we see that there is an increase in the number of people who are either overweight or obese. So, as we can see, our populations in general are not exercising or exercising less or just a few days uh, in, uh, in a week. And as a result, we have other issues like people watching TV or playing games or going or having two or three jobs or taking care of kids. So there are different non-clinical needs also that are making more difficult for our patients or communities to exercise. Next slide, please. In fact, if we continue to read the guidelines and for Americans and the type of exercise that they are doing, you may know that there are different ways that we can exercise. We can do, aerobic exercises or strengthening, and if you see, just 24% of the people who were interviewed here said that they are doing both muscle strengthening and aerobic, and about 22.7% said that they met only the aerobic portion. And remember that the recommendation for all patients, including children, adolescents, adults, and seniors, is to combine the type of exercises. But what is really troubling here is that about 50% of the US population is not exercising. Really important to know when we have this conversation with our patients, when we're having a conversation about food is medicine, as we have covered, when we have a prescription, a food prescription for our patients, we also need to find out whether or not they exercise and the level of exercise that they do. So next slide, please. So it is really interesting to see, depending on the literature that we review, but there is data showing that when a doctor or a clinician or a nurse prescribe or recommend exercising, people are more likely to exercise. So it's really important to have this conversation with our patients, making sure that they understand why it's so important and how they can build an exercise program. As clinicians or as nurse or nurse practitioners, we need to make sure that we have this conversation with our patients. And there are some exercise prescription that we have a resource that we are going to share in a few minutes, but we need to, every time that we have a conversation with our patients, we need to talk about how often they have to exercise, about the intensity, and the intensity is a difficult topic, honestly, because it will depend on the age of the patient, whether or not the patient has other chronic medical conditions, if the patient is hypertensive, or if the patient has any heart disease, and we cannot say because someone is a senior that this person is not a person who can exercise and do more vigorous activities. I've met many patients that over 65 years of age that they have run marathons. So it will depend, and we need to individualize this type of activities with our patients, and then we need to discuss the time, the intensity, the type of exercise, the progression, and ideally, if we are talking to a patient who is obese, who has never exercised, the recommendation is to start slowly, probably 10 minutes, and then this person can increase by 5 minutes each month until this person reaches the 30 minutes that are recommended for anyone. Next slide, please. So we have another poll question. We like poll questions here. And this is a true or false. Let me know what you think about this. But we can answer both questions at the same time. And only the first one is only 5% of clinicians believe in advising exercise. Is this true or false? And the second one is only 14% of clinicians prescribe an exercise program to their patients. True or false? All right. So this, I see that there is a mix for the first question. The right answer is that this is false. About 90 to 95%, no one believe in advising exercise. But the challenge is that only 14% of them prescribe an exercise program to their patients. That is true. The second question is true. And that's the first challenge that we encounter when we have conversation with our patients, because all physicians, all clinicians know that it's important for our patients to exercise. But sometimes we have the challenge that we don't know how to do it. We don't have a program in our location. We don't have some programs or some connections in the community. And very important, sometimes we're unaware or we are not familiar with the recommendations. So next slide, please. So remember, when you are talking to a patient, when you are going to recommend an exercise program, make sure that the patient has a medical evaluation before any exercise program that this person is going to get involved in. Specifically, we're talking about many conditions, but if the patient is if the patient has diabetes, for instance, we need to make sure that the diabetes is controlled. We need to talk about hypoglycemia symptoms, making sure that the patient understands when the patient needs to stop. If the patient has any hypoglycemic symptoms, or if the patient has cardiovascular conditions, if the patient has history of a heart attack, for instance, or if the patient has COPD or any other conditions, we need to make sure that we get all that information before we recommend any exercise program to our patients. And let's make sure that this conversation is with someone who is familiar with the medical history of the patient, in case there is the need to adjust medication, and specifically the medications that are used for diabetes or blood pressure. Thank you for sharing that, Alicia. Let me take a look at the YouTube. Okay, thanks so much. We recommend this YouTube walking program when appropriate, safe as well. We will also refer to physical therapy to get someone going if they need a place to start safely. Excellent. Those are really nice and excellent. Those are excellent tips. Thank you so much for sharing that. Next slide, please. So this is a physical activity readiness questionnaire that we can use. This is the PAR-Q. And specifically, we have some questions just the patient needs to, this is a yes no questionnaire where the patient is letting us know whether or not there is any contraindication or any challenge for the patient to exercise. Is very useful and very simple. We can use it, and it's not going to take, I am assuming, no more than 2 or 3 minutes for a patient to go over this. And this is going to be a really good start if you are recommending an exercise program to your patients or to your populations. Next slide, please. These are the how you can read the PAR-Q. If the person has responded to yes to one or more questions, you need to make sure that this person gets some advice from the clinician or from the person who is responsible for their health, from the person's healthcare. And if the patient's or if the person says no to all questions, then this is a really good opportunity to let them know that they can start exercising. If they have never done it, they need to start gradually, making sure that we have, now that we know the tips and we know how to talk to our patients, how to use motivational interviewing, is really important that we use those techniques with our patients. And remember that if the patient is pregnant or the patient wants to become pregnant, then that's another flag. So the person needs to talk to the doctor to see whether this is, if it is safe for this person to start an exercise program. If the person has already or is involved in an exercise program, and then this person gets pregnant, there are no recommendations on that unless there is something during the pregnancy that is for which you don't you have to advise the patient to stop any exercise program. Next slide, please. This is another resource that you can use. Is very interesting. As we said, only 14% or about 14% of clinicians are prescribing an exercise program to patients, and this is a really good resource that we can use. If the patient is able to start an exercise program, then we need to let the person know the type of activity, either aerobic or strength exercising, and then the number of days, then the minutes, and the total minutes per week. And is very useful because, as we said, when a patient receives this type of prescriptions, they are more likely to start an exercise program. Next slide, please. Okay, knowledge check for everyone, and we can use the chat box here. What are some benefits of physical activity? This is a question that our patients are going to ask. Doctor, or why do I need to exercise? So what are the benefits? What I'm going to get out of this? What would you respond to this question? Anyone who would like to participate and let us know? How would you respond to a question like this from someone who you are recommending an exercise program, and sometimes the person is either reluctant or the patient or the person is not someone who likes to exercise?
One of the benefits, it could be improves heart health.
Correct.
Another helps like with weight management, controls blood sugar levels, improves mood and reduce stress, and improves sleeping, increase the energy, and strengthens bones and muscles.
Those are great responses. Lisbeth, and I totally agree with you. All these are really good responses for someone, and specifically when you are talking to a patient, and if the person is diabetic, for instance, you can say that this is a great way, as you said, to normalize, glucose in the glucose levels. That is also going to help the patient to lose weight if the patient is obese. If the patient is over 60 and is looking for a response from you, you can say exactly what you said. Your bones will be, stronger. There is less risk of osteoporosis or any other condition like arthritis. Also, if you add some flexibility, some exercises to improve flexibility, you will become more flexible, and you will be able to do some chores, that you sometimes you cannot do because you don't have enough flexibility. In regards to someone who is saying that cannot sleep, of course, this is going to help the patient. And all the responses that I see here, and Fide, you can help me with the responses, but all these are really good responses and really good opportunities to talk to our patients about these tips, and benefits. There are others that are really important and that now we are paying more attention to. When we exercise and when we follow a program and we have a routine, we are more likely to feel better, and our mental health gets better. So if someone has panic attacks or anxiety disorders or depression or any other issue that is a mental health issue, patients can really, really improve just by exercising 30 minutes a day. Also, there are other studies that we have seen that patients with Alzheimer, as well, let me backtrack. An exercise program can delay, the onset of Alzheimer. So all these are really good tips for someone who is trying to start a program and the person is hesitant to start the program. Next slide, please.
We do have some additional comments here, Dr. Neil. There's one specifically, if Alicia mentioned, if medications are expensive and they're struggling financially, increasing activity can help decrease medications and lead to saving money. Absolutely.
That's a great incentive, and I fully agree with that. We had a very brief conversation about this, Alicia, and we need to adjust the medication. Sometimes I've seen patients improving their blood pressure because they start an exercise program, or patients who are on insulin or any other medication for their diabetes. You will have to adjust the medications as well, and they can save money. That's an excellent point. Now, this is another challenge, and this is for almost many of my colleagues, and specifically what type of exercise we need to recommend to our patients. And is very difficult for clinicians, and we need to rely on some subject matter experts. I mean, that's the reason why we were asking about whether or not you are working in the community with an organization, because you need to rely on people who are more knowledgeable on this particular topic. Specifically, there are some trainers and coach out there who can really develop a program based on the needs of the person, and second, these people can evaluate whether there is a challenge for our patients. But in reality, we have 4 types here: the aerobic training, the strength or resistance, balance and flexibility, and the HIIT workout. And the last one is a high intensive exercises. You know, if the person is in really good shape, we can recommend like 2 or 3 minutes of intense exercise, and then some intervals, you know, where the person can rest for a moment and then restart what they are doing. So this is really important, and is this particular workout has shown that is one of the best exercise program for someone who is trying to lose weight. Next slide, please. So we talk about all these. This was part of the question that we asked about the physical. What are the benefits of physical activities for adults and older adults? I want to focus on a couple of things here, specifically regarding mental health for someone who is having an anxiety disorder. We can also recommend, in addition to all the chronic medical conditions that we know, you know, like hypertension or diabetes, or if the person has any type of issues like lung diseases or whatever. Let's uh, let's talk to our patients about anxiety disorders, so we can reduce the risk of depression. There is another one that is really important, and we heard from our participants about referring older adults or having program for older adults. One of the biggest concerns when we have seniors is the risk of falls. And by exercising and by strengthening their muscles and by improving flexibility, they can lower the risk of falls. This is a huge concern. Many of these falls happen at home. And so these are really good tips for our patients. In addition to improve cognition, you know, and this is really good when we are recommending exercise program for children as well as we are, or if we are recommending this for senior patients. Next slide, please. So let's get started. We have different cohorts here, right? We can talk about what is good for children and adolescents, what is good for the adult population, and what is good for our senior population. So for those who are growing, you know, like our adolescents and children, we are trying to improve the bone health. We are trying to make sure that they are not get obese. We are trying to make sure that there is an improvement in their cardiorespiratory and muscular fitness. Remember that in this case, we are trying to prevent any chronic medical condition. We are going to improve their cardiometabolic health and cognition and reduce the risk of depression. And I am highlighting this and stressing this because we've seen adolescents, you know, the number of adolescents who are being diagnosed with depression is increasing in the United States and in the whole world. So let's make sure that we keep that in mind, and that if we have or if we serve this population, let's keep that in mind, and specifically that they need to exercise at least 30 minutes a day. Next slide, please. Then the literature that we have reviewed also show new health benefits, you know, like short-term, long-term, and disease management, and is really important to see here. And as we just discussed, you know, we can even decrease, you know, or adjust the medication that our patients are on if they exercise. But we need to understand and then communicate to our patients there are short-term benefits as long-term benefits, and there is also the benefit of improving any chronic medical condition if the patient exercises. Next slide, please. So in regards to mental health and brain health, we said that we can improve the quality of life and the cognition, and this is for all populations, specifically for our children and our patients older than 50. We need to make sure that they understand that if they get into an exercise program and if they do it part of their life, and and they have a routine, they are going to improve the health of their brain, cognition. They will delay any disease like Alzheimer's or anything else. Any of the mental health disorders that we also discussed and mentioned. But this is another good opportunity to talk to our patient about the benefits of exercising. Next slide, please. Thank you, Fide. What works to increase physical activity? So remember that we need to rely on other staff members. This is not just the responsibility of the nutritionist or the clinician. It's also the responsibility, of the social worker or anyone who is involved in helping our patients to improve their health and improve their nutrition and lose some weight, because we can create everything, and the doctor or the nurse or whomever is taking care of the patient can prescribe an exercise program, can prescribe some type of food medicine, and have a prescription and give this prescription to our patients. But many of you, or most of you, are working with patients who are either underinsured or has no insurance. They have housing instability. They live in places that are dangerous, or they do not have places to exercise. So we need to make sure that everyone, in the group is involved, and trying to find way for our patients not only to cover the physical and mental aspect and the health aspect, but we also need to address the non-clinical factors that our patients or that are the reason why our patients cannot exercise. So we need to work with, when we ask the question about in the community, who are you working with? We know that we can work with schools, we can work with YMCA programs, we can include some park police. I remember that we did a study here at the National Center for Health and Public Housing, and somebody shared a promising practice that it was really interesting. And they had some type of transportation. What they did, because this place, or this was an unsafe community, they took the patients, those who were registered or signed up for this, to a park, and they provided the transportation where these people could exercise, and there were police, around where they could exercise for 30-45 minutes, and they used to bring the patients back. So we need to make sure that we have all these arrangements in the community, so we can also address these non-clinical needs. It's really important because we can have the best formula and provide the best prescriptions, but if the patient is unable for different reasons to follow the instructions, then we need to make sure that we work in the community with other organizations to address those challenges. Next slide, please. We have some key guidelines for school-age children and adolescents. We mentioned that it's not the same to work with an adult patient who is healthy, or with a patient, or with an adolescent, or with a senior. But the recommendations are about the same. Since this population are much younger, the recommendation is to go up to 60 minutes or more per day. They can either do moderate or vigorous intensity aerobic physical activity. As part of those 60 minutes, we need to make sure that they do some muscle strengthening and bone strengthening. So we need to make sure that we offer the variety, the aerobic, the muscle strengthening, and the bone strengthening to our children and adolescents. Next slide, please. For adults, this is a bit different. The time is, ideal time is about 30 minutes per day or 150 minutes per week. If the person is able and the person is in good shape, you can increase up to an hour, 60 minutes every day, or 300 minutes. But making sure that if you do that, the person on the clinic and the provider work with someone who is more familiar with this type of activities, and again, either a coach or someone who is going to really be involved in the physical activity of these people, but of these patients in this case. But is really important to make sure that we also mentioned, that if the person is doing some muscle strengthening, the person needs to work, the major muscle groups 2 or more days a week. I've seen some routines, and here is where we can get additional, or we can have additional conversation with our patients, specifically with young adults and adolescents. They go to a gym and they do not follow instructions. So if they do not follow instructions, they are more likely to get hurt, or they are more likely to have, instead of benefits, we can have some diseases, conditions, or anything, that is not good for our patients. So generally, I've seen routines from experts talking about. Thank you, Lisa, for being with us today. Thank you, and have a great day as well. So it's really important to talk about, how they need to exercise, how that they need to do this in a controlled way. And if ideally they need to get the advice from someone who is an expert on this particular topic. Next slide, please. Then we have a key guideline for all the adults. Again, it will depend on whether or not our patients have any chronic condition, whether our patients have exercised in the past. But here, the type of exercise can change a little bit, depending on the health of our patients. The recommendation is about the same, 30 minutes a day or 150 minutes a week. This can be the patient can walk, like this picture, go to the park, making sure that they have also the environment, and if they can do these type of exercises or this type of activity with someone else, it will increase not only the physical activity, but it will improve the mental health of those doing exercise in parks or in open spaces. Next slide, please. Now, for those with chronic medical conditions, the main recommendation is here that they need to get advice from the clinicians, making sure that if they are able, they can exercise for 30 minutes, depending on the type of chronic health condition that they have, or if they have a disability. is always important to work with someone who is familiar with the type of disability. Most of the patients with disabilities know what the limitations are and what they can do and what they cannot do. So it's important to listen from our patient and at the same time listen to our patients and at the same times pay attention to the relatives because the relatives are very well informed about the conditions of our patients. So let's make sure that we have conversation with our patients who are disabled or who have chronic health conditions to make sure that they are going to get a benefit from the activity that they are planning. Next slide, please. Ideally, if the patients have a disability of a chronic condition, there are some guidelines that they can follow. Again, that is about 30 minutes a day. We cannot recommend someone who has a disability to perform the same type of exercises that someone who is not disabled. Or who is not disabled, and make sure that that we offer some variety as well as some recommendations to make sure that we are addressing both the health of our patients and the need to exercise. Next slide, please. For pregnant patients or those who are in the postpartum period, the recommendation is that if the person can exercise or is a person who has exercised in the past, this person can continue their exercise program. But if there is any complication or if there is any risk for the patients who are pregnant, they need to be evaluated, and ideally they need to stop exercising unless the doctors approves the exercise program. Next slide, please. Remember that when there are some tips as well. If the idea here is to get benefits and from an exercise program, and the patient making sure that the patient gets involved, but at the same time the patient is not going to have any complication from exercising. So we need to individualize and any exercise program, making sure that we talk about risks. If a person likes cycling, for instance, it is imperative for this person to wear a helmet. If this person likes or wants to go to a gym starting a strengthening program, but the patient has some joint issues, then let's make sure that we address the joint issues first. If the person has some balance issues as well, let's make sure that we first address the balance issues. So there is so the person or the can benefit from all these exercise programs. Next slide, please. So just a brief another interactive activity. This is what we have found, or what we usually see when we have patients, and we have some excuses like, I find exercise difficult and uncomfortable. I feel self-conscious when I exercise. Physical activity makes me hungrier, and I'm afraid of getting injured, or it's too hard to stick with exercise or with an exercise program. Remember that we discussed these in our previous sessions, and we have a conversation on motivational interviewing, and for each of these sentences or excuses from our patient, we need to make sure that we find a point, to start a conversation and make so the patient understand that it's not so difficult, that they can start slowly, that if they have never exercised, they need to find a motivation to do it. If they feel self-conscious, and this is because there must be behavioral or mental health issue with our patients, and we need to address those issues as well. So make sure that you are prepared for any of these um, comments from your patients that when they are trying to avoid, or saying why they cannot exercise. Next slide, please. So it's time for a case study. So please help me with this patient. Please help the team with this patient. But this is Mr. Smith, a 40-year-old man with a history of hypertension that is under good control using medication. He works as a taxi driver for 8 hours per day. He smokes 1.5 packs of cigarettes per day and has done so for over 20 years. His father died from a heart attack at age 60, and he has no signs or symptoms at this moment of any cardiorespiratory disease. He just completed a medical checkup, and the report shows a body height of 173 centimeters and a body weight of 88 kilograms, the cholesterol of 8 millimoles per liter, and a fasting glucose of 5.4. His BMI was 30, his hip circumference was 40 inches, and his waist girth was 47 inches. Next slide, please. So first, based on what we have discussed, what are Mr. Smith's health risk factors? What we need to know, or what we need to make sure that we address with Mr. Smith? Anyone who would like to respond verbally, or anyone who would like to use the chat box, please feel free to do it. Kelly saying stroke. Okay. Yes. Remember that our patient has a lot of risk factors for a stroke. He is a smoker, a current smoker. He has hypertension, and he has family history of heart attack. Then Fide, I fully agree with you. This is a job where he's basically driving the entire day, and he is not able to exercise. I fully agree with you that this is one of the risk for this patient. And Adriana is saying ensuring quality of life. Of course, if this patient is not exercising, if this person has a life, that where basically his job is about driving and not moving and not being active, that the patient is more likely to affect his quality of life. Thank you so much for participating. Next slide, please. This is another case study and the last one, but we are going to talk about Ms. R's severe obesity and an inability to lose weight on her own. This prompted her referral to the Clinical Weight Loss Center. Her physician is concerned that without intervention, she will develop type 2 diabetes and heart disease. We have the clinical findings: age 62, female patient with history of hypertension, insulin-resistant, hypothyroid, previous ankle injury. She is 64 inches, 253 pounds. The BMI is 43.4. The body fat 44.2, and the muscle mass 30.4 pounds. Her blood pressure was 132/84, the A1C 6.1, and the TSH 2.2. The patient is on lisinopril, metformin, levothyroxine, and sertraline. And she's in a dietitian in the office to address diet. She has exercise on and off. She saw success with group classes, but has increasingly felt uncomfortable in a group setting due to insecurities. And currently, she's walking her dog once or twice per day for 10 minutes at a very low intensity and isn't doing any strength or flexibility training. Next slide, please. So let's talk about risk factors. What are we seeing with what are we seeing? Does the patient have any contraindications to exercise? Um, what additional information would you like to get, and what special considerations? Let's analyze everything from our patient. Anyone who would like to participate verbally, or again, you can type your response in the chat box. Well, here we see a patient who is 64. The risk factors is that the patient has some comorbidities. We know that she has insulin resistance, hypertension, and hypothyroidism. And there is the BMI is very high. We can say that this is a type 3 obesity. Alicia is saying, has she taken the physical activity questionnaire? This might help her have confidence to get started. Sounds like she has exercised previously. That's great. That's an excellent response, Alicia. And yes, that's the first thing that we need to make sure that we address, whether or not, in addition to the comorbidities, in addition to the previous history, our family history, and her obesity and everything else, we need to make sure that we get all these responses from her, and we can use the questionnaire. That's great. Is there anything that we would like to get from our patient? It seems that the patient has exercised in the past. There is some insecurity because of I would like to hear from this patient about stigma, for instance, whether or not she's been stigmatized, whether or not that has been a concern for her, whether or not there has been any other issues, and any other issue that we need to consider, whether or not the patient has history of family history as well of any chronic medical condition. So all these things are very important to consider when we have a conversation with our patients. So remember, we need to make sure there are a couple of tips here that next slide please, that we need to consider. First is, as we said in the very beginning, we know when our patient is obese, just by if we see a patient for the first time, even if we receive before we receive anything, from the vital signs or whatever, that's the first thing that we see. And remember, it shouldn't be the last that you discuss with the patient. So I'm going to stop here for a moment and see whether there is any questions for us. Please, you can ask your question verbally, or you can type your question in the chat box.
I have a question
Yes.
related to the case too. So in the description of the patient, the doctor said her physician is concerned that without intervention, she will develop type 2 diabetes, but she's already on medication like metformin. Could you explain me a little bit this? Because on my knowledge, this is confusing because I know people who already are with diabetes, they are already prescribed or they are taking medicine like metformin.
Yeah, that's an excellent question, and you got something that is quite tricky. And thank you so much for your question. And I will respond, this way. The American Diabetes Association is recommending metformin for patients who are not diabetic but are at high risk of diabetes. For instance, for pre-diabetic patients, the recommendation for some of them, especially for those patients who cannot exercise, is to start metformin. So even if the patient is not diabetic, but the patient is pre-diabetic and is not exercising, the American Diabetes Association is recommending the use of metformin.
Okay, thank you.
You're very
Helps
welcome.
me a lot. Thank you.
That was a great question, an excellent question.
Thanks.
So we are at the top of the hour. Next slide. And thank you so much for participating in these 4 sessions, ECHO-like sessions. If you have any questions, please let us know. In the meantime, please complete the post-evaluation. Next slide, please. You will have here the contact information of our team, my contact information, Fides and Shimoke's contacts. If you have or you would like to follow up on this, let us know. Also, FIDE is my understanding that for those who completed the training, there will be some type of ECHO certificate. Can you talk about that for a moment?
Yes, of course. This will be provided to everyone that attended all of the 4 sessions. So you should be receiving a certificate of completion in your email soon.
Thank you so much. And thank you, everyone. Have a great afternoon. And thank you so much for what you do and the services that you provide to the community and to your patients. Thank you.
Thank you, everyone. Have a great day.